We are live. Okay, YouTube is live. It's 1:30.
You know, he was planning on it. However, he got his second vaccine, and he has digital fever.
That was my son, he got his, last night, he was
Yes.
feverish, diarrhea, stiffness.
Yes. So, he felt it was in his best interest to do this.
Did he get Pfizer or Moderna?
I believe he has Moderna. So, yeah, I think people are having with both of them, you know, your immune response is actually supposed to happen. So, good. Thank you for reading the note. Going up to it.
Okay, we'll go ahead and convene at 1:30 now with the Board of Health. And Bobby, I'll let you take over this meeting and you can go over more.
Okay, well, we'll follow our agenda, and we normally sit like this for Board of Health, so that we're all kind of down here. A lot of times we have guest speakers, we oftentimes have more people than this here, but this way we can have conversation. That's really what a Board of Health is about. Conversation about public health issues in our community, and getting support from our partners. So, I'm Bobby Locke, I'm the director with Montezuma County Public Health Department. We're glad to have you, two new commissioners on board. We're looking forward to years working together. And, what was the list? I'm Laurel Schaefer, the assistant director and finance manager, grant manager, office manager type. I've been with the county for going on 11 years.
Nice to meet you ladies, thank you.
Nice to meet you.
Okay, so we did have a general meeting in November. I don't know how we approved minutes when we had.
do it anyway.
Okay, all right, so, do you have to?
I did look at them.
I did too, but I
I don't have them in front of me, but if you guys want to, we can go ahead and move it. We accept the minutes of the meeting of November. I don't have the actual date in front of me. But the November minutes, and we can actually approve them. I have read them, and copies of them.
Right. Laurel typically puts the minutes together for us, and they are posted on the, under the public health part of
We need a mic over there. People on YouTube can't hear you.
Here, I'll let you take it.
Okay, so, let's see. What we thought we would do today, being, we have two, one new commissioner, one returning commissioner, right? But a lot of things have changed, you know, over time. And in 2008, things really shifted for public health. So with the policies and stuff they put into place. So we do an overview, kind of. I know all the county departments are doing like kind of presentations to you all about what they do and different programs that they offer, and so we're going to kind of incorporate that into that's going to be our meeting today, and then we'll end with a conversation about COVID and update you guys on what's going on with that. So in your folder, I have given you this. It's a trifold brochure that we have, okay? And it lists pretty much categorically the different programs that we do in the health department. You guys can look at that at a later date and review some of that, but I thought we would just go through the other piece of paper I stuck in there is a list of all the programs that we do, okay? So we do a lot of different programs. Every program has its own budget, and Laurel is amazing at keeping us straight financially and supporting me and all of our decisions that we need to make and how we need to adjust things. I'll just start at the top and work our way down, and I'll just say a few words about each one. And if you've got questions as we go, just please feel free to ask. So again, in categories, WIC is Women, Infant, and Children Nutrition Program. That is a federally funded program, and it is for families with children 5 and under. And it is for any type of family, whether it's dad raising kids or mom or grandma or whoever, anyone who has kids 5 and under. And it's a financially qualifying program. It is very structured. There's typically, in a non-COVID world, the visits are done in the department. They bring in their children. They get weighed and measured at different times. If they're pregnant, they get, again, weighed and measured. And there's a lot of education. It's a very strong promotion on education, good nutrition. We really support breastfeeding moms as well. It is very much a support mechanism to help people have healthy children, which in turn ultimately helps everyone, because they turn into healthy adults. So that's what the WIC program is. And then we have a WIC mobile van, which that was through the Colorado Health Foundation, right? We had written a grant for that, and you might see it over in our parking lot across the street from the health department. That van we take out, well, not on a day like this, but we take it out and we deliver services. We deliver food sometimes. We do visits in that van. We have a scale in there. We have the whole capacity to do the WIC program out of that van. So we make it convenient for people to, participate in the program. Okay. And Baby and Meat Tobacco Free is also, we kind of have them lumped together. It's kind of the same staff that do all of these programs. And that is a program to get people to stop smoking. It's a smoking cessation program. It's a support program. And they get incentives. It's for 1 year. Isn't it for 1 year that they get the diapers, free diapers, if they have a little device that they have to blow into, and it measures their levels to make sure that they haven't been smoking. And when their level is such that they qualify, then they get their free diapers. So it's an incentivized program to assist people to quit. So.
And that's funded from the Rocky Mountain Health Foundation.
Mm-hmm.
So they support that. We do the work. They give us money to pay for our staff to do that work.
Right.
But they buy the diapers and they
Right.
deal with all of that.
Right.
And can I add something about the
You
WIC
bet,
program?
yeah.
I just wanted to add in there that we have, over the last couple of years, worked with local food programs that support local farmers that are, I guess, I don't know if you, farmers that grow items, and we get that food out. And she's also very passionate about teaching how to preserve that food.
Yes.
Teaching these families how to preserve that food, and canning, dehydrating, all kinds of different things. And
Yes.
she works on that, and we get a lot of that food.
We were holding in-person classes. That kind of has gone by the wayside as far as that type of thing for now. But we will get back to that easily. So, and every time it was full, with the waiting list. And then with those classes, the people who signed up for those classes got to take their crock pot home, or got to take their blender home, or whatever it is that the class was about. That was part of what they get to have that take home and to use it for future recipes. So, yeah. So that's a really, thanks for adding that, Laurel. Do you have any questions about those family services programs that are listed
The
there?
other thing I might bring to your attention too, if you guys haven't seen that WIC van or actually even gone through it, we had the opportunity to go through it when it was purchased. We had a tour. I can't remember who gave us a tour, but it's
Yeah, we'd
kind of
love
like
for
a
you to
little
come over.
office. It's actually kind of cool.
Yeah.
So if you get the opportunity, stop over and see if you can, actually go through it and see what's there.
Bobby, didn't you also take the commissioners on visits with you?
We did.
Or your family?
We did, mm-hmm.
And I remember, I think Larry Don and Ian, was that before your time to do that?
I had it scheduled a couple of times and then I got canceled out on.
They were impressed by it.
Yeah, I know.
That's all I was gonna say. Is that
Right.
They thought that was cool. I don't know if you guys
Right.
want to do it or not.
I think it would be great. We'd love to take And since you have not been out either, Jim, I mean, we could totally get you scheduled, partnered up with one of our home visitors. We're just now getting started back into the home. We've been doing everything virtual. But given what our community is looking like, once all of our nurses have completed their vaccines and they're 2 weeks from vaccination, we're going to start doing home visits again and get them out into the homes. So, maybe not right now, but in the next couple months, we'd love to arrange something and take you guys out on home visits because, seeing, how our families, some are struggling more than others, right? But it definitely gives you an appreciation of the massive amount that one particular program does. All of our programs touch families, though. But being into people's homes, it's a whole different level. So, yeah, we'd love to. If you guys ever want to come over to the health department, tour you around, show you our dental program, which is just like a regular dental office now, it looks great. It's been remodeled, and we have a lot going on. So that takes me into the dental program, which we wrote grants for and got several different grants in order to be able to do the remodel. And we are functioning. Again, COVID impacts everything. But we've never, only early on, we closed dental for 6 months, was it?
No, it was more like 3 or 4 months.
Was it 3 months? Okay.
And that did impact us this year.
It did.
But
It did, financially.
it's impacted everyone.
Yeah,
So
yeah. But we opened up in June, I think it was, or July, and just slowly kind of brought things back to normal. But we are doing everything in that clinic that we would normally do. I mean, we do all the dental services up till, we don't do, oh my goodness.
Cosmetic?
Yeah, well, no, we don't do cosmetic. But we definitely, pretty much every service, we do root canals, we do, crowns, we do all of that. Yeah, we do all those services, and of course, dental hygiene. We have a couple hygienists on staff. One of our hygienists is our dental coordinator. We have one regular dentist that works with us, regular meaning routine dentist that works with us, 2 days a week. And then we have another couple dentists who, depending on their schedule, fill in on days that they can, because a lot of them have other jobs. So, but we are busy. We are definitely busy in dental. It's functioning every day. We have 2 chairs. So, so that is our dental program.
Let me ask you a quick question.
You bet.
In here it says dental care for eligible Medicaid, uninsured, and underinsured children
Correct.
and adults.
Correct.
How do you determine underinsured?
Somebody who might have insurance, but what they have insurance for doesn't cover dental, number one, or doesn't cover, maybe they need a crown,
Okay.
but their insurance doesn't cover crowns.
high deductible. type of
Yeah,
thing.
people have super high deductible.
I'll be over next week.
Sounds good. So yeah, I mean, and then, I mean, if somebody, because we've had, and we also support through our dental program, we support our school-based health clinics as well. Okay, so we go to SWOs. We have been to the middle school, Cortez Middle School, the high school, Dolores, Mancus. We've been to all of the schools as far as seeing the kids while they're in school, so that the parents don't have to pull them out to go to an appointment. It really helps decrease people from having to miss work and for pulling kids out of school. So it's a really nice, convenient service to provide for kids. So we have been doing that while school is. Everything is always this preliminary thing about COVID. Before COVID, this is how we used to do. I mean, the levels of impact has been on everybody, right? I mean, it's just been incredible. So then we go into the parenting program. So the Nurse-Family Partnership, we already kind of touched on that a little bit, and we'd love to circle back with you guys in a couple months and see if we can get you scheduled and hooked up with one of our nurses and you can go out on a visit. That's really the best way to see what that program's all about. So, okay.
We have one of the highest retention rates in the
We
state.
do, we do.
As far as, when somebody starts a program and finishing it, I think we are 78%, and I think the state average is almost around 50,
Yeah.
so.
It is a program, it's a partnership, meaning that we like to get parents on the program while they're still pregnant, and we follow them and continue to do home visits with them clear throughout their pregnancy and through the first 2 years of the child's life. So it's really 2.5 years that we work with these families. You really, really get to know them, you're a part of and it's only for first-time moms, okay, so, or dads, but it has to be the first baby,
Right.
okay? So it definitely is a certain population that it touches, obviously, but you really it's a really powerful, powerful time in a family's life when it's their first child. So it's a great program, and they're only nurses that do it. So that's what the Nurse Family Partnership is. So we've been doing that program since 2000 here in this county. Let's see. Communicable disease, several things fall under this. So we have our immunization clinics, which are every Wednesday, unless it's a holiday, from 10 to 5:30 by appointment only. Years ago, we used to do it without appointment. It got to be not a good way to do things. So it's by appointment only. That way we can guarantee that families can get the time they need for the educational piece, for the support, and to make sure that they understand, what vaccinations do and what's the purpose of, and answer any of their questions, and then vaccinate their kids. And we don't just do kids, we do adults too. So the only immunizations we really don't cover are travel. We don't do travel vaccines. We encourage people to go to San Juan Basin in Durango. We've never done travel vaccines here. Okay, so that's our immunization clinic. Community-wide flu clinics, we used to do specific flu clinics. We didn't do that at all this year because everything's been COVID, but we had people come in for flu vaccines, so they could make an appointment and we would, do their flu shot.
Yeah,
Did we do-
budget-wise, we met our same goal, our same
Right.
amount as last year. So
Right.
we were able to provide the same amount, and we didn't change the price. So
What is the price? Just,
For a flu vaccine.
if you were
Yeah.
just to walk in the door, $30. And that's, yeah. And then that's, I think kids are different. Kids are less.
We do not take Medicare. So when we get the 65 plus that come in for a flu shot, we encourage them to go to a pharmacy. Yeah, or their primary
Healthcare
care doc,
provider.
But we used to do Medicare, but then Medicare changed things, and then there was this you had to pay a huge, like a membership fee to be a provider of Medicare. And at that point, the only thing we were doing for Medicare was flu vaccine, and the provider fee was larger than what we wouldn't even get, pay for a cost of us to do it. We would have gone in the hole by doing it. When the service is offered through Medicare, through private pharmacies, or your primary care doc. So we had to back out of doing that. And that was a hard transition for our population, because they got used to coming to the health department, and it was a kind of a nice social time for the older population, but we just couldn't do it.
Yeah, that was part of the Affordable Care Act, and it expanded those flu vaccines to pharmacies. It increased the amount they could give, so then
Right.
it was more cost-effective for people to go to the pharmacy than it was to.
Yeah.
come to the health department.
Right, right. So, while we're talking about the Medicare issue, I just wanted to make sure, I heard this morning at your BOCC when Gina was talking about Medicaid, okay? We in the health department are a Medicaid provider. We have been for
As far as I can see,
eternity,
yeah.
I think.
Oh,
So just to let you guys know, I mean, we bill, all of our immunizations, a lot of them, we bill Medicaid for. Our dental program, we bill Medicaid for. Every one of us nurses are Medicaid providers. So Laurel had done all the work and did all the registering, and you have the terms down better, but the certification process, and then periodically you have to go through the whole research process again. it's kind of a bit of a nightmare and a challenge, but we've been doing it for a
And
long time.
I think that's what she was pretty much saying this morning to us, that it sounds like there's quite a few hoops to jump through. So
Sure.
would that cross, could you
Well,
work
well-
Reach out to her, Bobby, and
with-
just tell her
Could,
to
yeah,
do it.
could she
Gina
run under
to-
your Medicare license for some of these therapies? Or Medicaid? I'm sorry.
Yeah, so everybody has a national provider ID, so we're identified under our NPI number as the
Right.
health department, so I would assume that she would have her own NPI.
Right.
And then credential whoever is able to bill, so it sounded to me like possibly some therapists.
Right, it seems like
certified
the counseling
counselors.
piece is what she's,
So they
yeah,
would have to
yeah.
get credentialed, so you have to credential your entity, and then you have to credential the people who are gonna provide services, and then they have to marry.
But you could help her walk through those hoops or steps to actually,
I think she's
Maybe.
already, it sounded like she already had something in place with somebody this afternoon. She
I
had
mean,
phone
I'd be
at
happy to
1:30.
help any
But
way I can, it's just, right now.
It might be challenging right now because of our vaccine
Sure,
situation,
right.
where, you know,
We just-
but
Yeah,
we
but
absolutely
absolutely.
could support Gina in some of this. I had no idea she was doing it until I heard it today, when she was talking to you guys. But I do think that the one, I just want to make sure we don't have a problem with our tax ID number.
We
Because
shouldn't.
we shouldn't have a problem, but,
We shouldn't, and, you know, I mean, we have a Medicaid provider ID for our nurses.
Right.
And Medicaid provider ID for our dental staff, under the same tax
Under-
ID number.
right.
And then everybody has their own MPI, it's,
So they should,
Complicated.
social services should still work under the same tax ID number that we're working under, because it's the county
County.
tax ID number. But then they would have their own MPI number as an entity.
and provider.
And a provider. And then
ID.
each of the people, I don't know how many counselors she's got, I know the one, but, you know, I don't know if some of her workers, I don't know if there's reimbursement through Medicaid for her caseworkers. I don't know that, if there is or not, and she might be looking at that too down the road. I don't know what she's able to bill and what she isn't able to bill. But I just wanted to make sure that, you know, because sometimes, even though we're all working for the county, everybody kind of sticks in their little silo, and you don't know what each other's doing, and I did not know that she was doing this application, and we may have, up till now, might have been able to help her, but, you know.
which I think is, when is our next, meeting for elected officials and department heads, Shaq, is that?
I think it's in March. I don't have that
So-
calendar.
It
in
feels
front
Yeah,
of me.
she'll, still quite a ways in the distance, so you might just touch base just to see if you can help her out or
Well,
communicate,
yeah,
coordinate that.
Yeah, I, like I said, I didn't realize that was going on, so, but I
That's the
think it
only
would
time
be.
that I hear the updates of all of the other
Sure. sure.
people, and if you forget something that day, then the other person doesn't know what's going
Right,
on.
right. And it is a process, and even once you get it done, then they throw another, oh, now you need to recertify.
Yeah, it took us 6 months to recertify
Oh,
under the new,
that was crazy.
the new Medicaid change. And, I think we have to recert again.
Yeah, you know sooner you get
But
it
I'm a
done.
pro now, I hope.
Yeah, until they change the rules again.
Yeah.
Anyway, okay. Our next big topic is environmental health. Okay, so environmental health is a lot of things, as you can see. So it's food service, childcare and school inspections, on-site waste treatment system, permits and inspections, waste tire management, and zoonotic disease surveillance, and that's basically bats, dog bites, things like that. Hantavirus. So those are all the things that encompass under environmental health. Now, some of the zoonotic pieces, oftentimes nurses will end up being part of that. So that's not just our environmental health person that's doing that. And even sometimes we could have a water treatment problem that it'll involve nursing as well with that. So just depends on what the issues are. But there's a lot under environmental health, a lot of pieces. And, you know, Melissa has retired. Melissa has made her decision, and she's not going to come back. So, just so you know, because we were trying to get her back just for a little bit to help with environmental health with the on-site waste treatment system. Talked to her this morning. She really is enjoying her retirement. So, and I'm like, awesome. I mean, I'm happy for her. And so, we are going to continue down the road that we're on, and Cody, who is our new environmental health specialist, he's doing an awesome job. He's really about following, the rules and doing it the right way and supporting our community. And so he's learned a lot since he's been here. We had a state inspector come from, I think it was Teller County. He used to work at Teller. I don't know if he still does. Anyway, he was here last week supporting Cody because now we're getting back into doing restaurant inspections because we hadn't done restaurant inspections because of COVID. So now we're back into doing restaurant inspections. So it was a big week for him last week, and it was very helpful to have Andrew here. And so, but Cody has also been helping us with our outbreaks, with our outbreak form reporting that we have to do for COVID. And when we first started this, we only had a couple, 2 or 3, no big deal. And Cody was helping. Well, when you get 12 in one day, it's a lot. So here's how we're going to deal with the outbreak thing. We are going to continue to do what we have capacity to do. And when and if he reaches that where he can't do the outbreak line list for us anymore, then I will have a conversation with the state. And we will discuss the fact that our capacity is non-existent for doing outbreak reporting. So I'm going to base it on when Cody gives me the, okay, I cannot do this anymore, then I will take it to the next level. So.
Which is, like I was telling you guys, the meeting I was on last night with the other 12 commissioners in the southwest corner of the state, one of our frustrations, and I'm sure it's been yours also, is the state has promised all of this help. And we're going to help you, and we're going to get you these resources, and we're going to do this and that. However, that's not really the case. And then all of the other commissioners in the same counties are overwhelmed also. And it just becomes a point to where you can't, your resources are, you can't do it anymore.
Right.
So,
you have to prioritize.
just part of where we've been throughout this last 10 months, we're doing the very best job that we can, and we're promised the moon, and we're not getting anything. So, just so you guys know that going forward with a lot of the stuff that we are getting, now some stuff has come through, so not everything, but a lot of the resources as far as what they're doing within public health just haven't been there.
And I had gotten an email, just to give you a little sample of what Jim's talking about. I had gotten an email from the state asking, we're 10 months into this, and they sent me an email saying, we'd love to help you with case investigation and contact tracing. 10 months into this. So I answered and I said, well, we've got that now. But where I could really use help is the outbreak navigation, the outbreak reporting. That would be awesome, because then my environmental health person has been helping us with this, but it's too much. And I got an answer back that said, well, we really feel that's best done at the local level, so we can't help you with that. So, so the one ask that I did have, they couldn't do. So, and I know they have their rules, and they're trying to navigate. They're at a different level than we are, but they're still navigating it too, because everything's coming from the federal government. So it's a tough spot for everybody, but I do think that we need to prioritize and dealing with our cases, dealing with vaccinating people who want it. That's really where our priority needs to be. And if we don't get to report all the outbreaks to the state, I think that's going to be going down on my priority list, if that's where we get. So anyway. So those are the kinds of decisions that we have to make sometimes.
So
Yeah.
what happens if you quit reporting outbreaks?
I don't know yet, Kent.
Maybe we should find out.
It's all right.
I would,
It's a crime. Oh, well, then then they're gonna have to provide us help, because it's a crime what they're doing to public health agencies. So I don't know,
Because we have a limited source of,
Right.
of people to do this, and you have to prioritize their use.
Right.
and right now the
And so
priority
we're-
is the vaccine.
Right.
I mean, that falls under your emergency procedures.
Right. So, our point, and so Cody and I just talked about this morning, later this morning after I talked to Melissa, that, you know, we're still gonna do it, we're still reporting. It just might not be every single one. I mean, that's just the reality. We're gonna do the best we can with what resources we have. So, I mean, that's really what we need to do. Because our priorities are people who live here and making sure that are tracking what we need to track and vaccinate the people who want the vaccine and isolate the people who are cases, and work and support people through this very difficult time. So, anyway, so it may be a conversation that we're gonna, you know, have to, if we get to that point,
I'm sure it's fine.
I'll be calling you.
I'm sure it's fine. But CDPHE orders are enforceable.
Well, there's a lot of things that CDPHE are saying, so.
Well, and it's throughout the state.
Yeah,
I mean,
yeah,
all of the other commissioners,
absolutely.
everybody that I talk to, everybody is struggling equally.
Yep.
Nobody has been
Right.
given what they were promised, and it's,
And we
And
just,
the
we
funded
do.
mandates in the state are
yeah,
also-
they're all unfunded
Right,
mandates.
well, and that, how often does that happen? Like every day?
Right.
So, yeah.
You can't operate at a level that's something that's written down and then not fund it and expect it to continue to be, you know, implemented.
And they asked for the help. And
Yeah,
the
oh
help-
yeah,
help
I
is
have the email.
unavailable.
Yeah, no, that's why, because when they offered, I'm like, this is great. Okay, so here's what I really need, you know? So, anyway, I tried. What else do we want to say about environmental health?
Do you guys want to talk a little bit about the smoke
Oh,
environmental
yeah.
issues, the
So-
purple air monitoring and?
Mm-hmm. So, yeah, so the air quality, we've gotten numerous phone calls about air quality in regards to the Aspen wall smoldering. And we do have purple air monitoring devices that can be placed in different parts of, well, they're around the town, around city. At one point, I had one at my house too when we first started them to just kind of see where things were in the county as far as the air quality goes. And so that is available, and we have communicated that to some of the folks that have voiced their concerns about the air quality in our community based on this fire that's smoldering. But there's really, for us in public health, we have an air quality, there's a division at the CDPHE, Colorado Department of Public Health and Environment. There's an air quality division. We have that air monitoring device on our roof, but that doesn't detect every single thing. That purple air has way more ability to detect stuff with it. So we've connected folks with the purple air, with CDPHE, but there's really not a whole lot for us here in public health that we can do about that fire or smoke that's, you know, burning up there
What
at
we
Aspen
do,
Wall.
Other than,
we do all summer long when we were inundated with smoke every day, every
Yes,
night.
right.
correct, so I talked to the emergency manager, I'll make this really quick, and the sheriff, and I think you guys got it late last night, basically a plan to implement going forward, you know, to try and mitigate the smoke or to keep the efforts of the smoke down. They are not stirring the fire anymore. They're going to allow it to settle. Obviously, this moisture that we have coming on top of it right now is actually great. It's not going to put it out because of the depth of the
The
fire.
underneath, yeah.
I think we have a 40-year pile, and
Yeah.
nobody really knows how deep that truly is. You know, it could be 30, 40, 50 feet deep. So
Wow.
there is a plan in place. They are working on it with the owners, and hopefully right now this will help to mitigate that as far as the smoke. So they're not going to stir it to actively keep it burning, because eventually you can eliminate the fuel, the oxygen, or the heat. So they were trying to eliminate the fuel quicker to get the fire put out.
I see.
So kind of right now, they'll let the moisture lay on top of it and smother it, and hopefully the air quality will get better up there. But the air quality monitors that we do have now are at the Cortez Fire
There's one at the
Station,
Cortez Fire Station.
Pleasant View, or Dove Creek?
It's gotta be Pleasant View. Dove Creek's Dolores County, so it's Pleasant View. Isn't there a
And then
third one? There is a-
Dolores has theirs in place, but they were waiting on their internet connectivity.
yeah,
I
what
think
oh,
it was
okay.
kind of like this, I
Yeah.
think.
Oh,
So we don't
okay.
really know if that is actually working or not working at this present time, and I haven't talked to
Oh.
anybody over there to really know.
And that's where they get a lot of the smoke too, down in Dolores from that,
Correct.
from that fire.
So,
yeah.
but that's being evaluated right now, so
Okay.
just so that people know, those monitors are out there.
Right.
Those can be looked up at purpleair.com,
.com.
and they can see what the air quality is. Actually, it shows the air quality around the entire state of
Right.
Colorado.
Right. Yeah,
So-
no, it's super interesting. And
So there is a plan in place. They are trying to work with the emergency manager, the sheriff,
Okay.
and to try and get that thing taken
Good.
care of and under control. So
Okay.
just
Good.
more reading for you guys.
And when I
Reading is all right, it's the retention.
and I did reach out to the program manager because that's, like, we run 25 different programs, different budgets. So I reached out to the air staff that
Mhm.
I connect with,
Mhm.
and they informed me that they were working with the homeowners.
Mhm.
Because
Okay.
they had directly, so wherever the homeowners had gone to at the state level, it did go back to them, and they were working with them to see if they could get purple air monitoring
Mhm.
in that area.
Mhm.
So,
And then, didn't we talk about a monitor out at Pleasant View also? Or,
I feel like there was a
That's-
conversation about that.
that was
but
the main one. So they wanted to come and pull the main one that's on the county annex
Oh,
building.
okay.
Just
That's
because
what they would have had to do, is move the one that's
They
on
would
our
have had to-
roof.
oh,
But that's
to
a
Pleasant
big system.
Yeah.
I mean, it's got this big
Right.
tower and then this
Right.
big setup up on the roof that we used to have to climb the roof up once a week and change the filter.
With a little wooden rickety ladder.
They have third-party auditors that come out and audit that, as well as state auditors that come out and read that. I would venture to say somebody's here once a month doing all of that.
Mhm.
It kind of looks like an old DOS NASA system, and they are in there, and sometimes we do the
Mhm.
troubleshooting for them.
Yes.
That's the one that they wanted to pull, and we had asked them if we could move it somewhere.
Mhm.
And then we had talked about doing that out in Pleasant View at the fire station, I believe.
Mhm.
well, the road and bridge now.
Yeah, Road and Bridge.
Right.
And then, of course, COVID hit, and we just haven't circled back. He was gonna go talk to his people, my person was gonna go talk to somebody and see if they wanted to move it, but,
Yeah, I think it's one of those things that got put on the back burner.
yeah.
Again, the prioritizing things, right? Not that air isn't important, but right now it became less important just because of what we're dealing with in every other aspect of public health. So I guess we can revisit that conversation, but it would be a big deal to have to move all that stuff that's already, on the roof but again, and somebody's gonna have to pay for that. I don't know if that's the state pays for that, I have no idea.
Yeah, I think
So-
they were wanting to just make it through the contract, and then we can
Right.
reevaluate when we bring that contract
Right.
for signatures again, if we renew that contract.
And just FYI, we have, 3 fiscal years, right? So we've got the county fiscal year, which goes January to December, and then a lot of our state contracts are July 1 to June 30. And then our federal contracts are October 1 to September 30. So, and then we have some oddball ones that are like, April or May, or anyway, the different,
Yeah.
we have many different fiscal years, so it definitely provides challenges, so. But I think the air is a June to,
The state fiscal,
yeah,
yeah.
the state fiscal year. Okay, let's see. Any other questions about environmental? No? Okay. Home and community-based services, that's our options for long-term care. That particular program is in this building, one level up, okay, on the 3rd floor, up there with Gina Montoya. So that program is, again, that's a Medicaid, we have Medicaid providers through that, right? So that program is all about keeping people in their homes as long as possible, if that's where them and their families want them to be. And their options for long-term care is kind of like the middleman. and they are the person who serves the individual client, but the client chooses who's going to be their provider, like, Pasco, whatever home health company is going to provide it, and our managers, our case managers, basically manage their case. Exactly, that's what it says. Like if the client has an issue, then that person helps navigate that between the business and the client. Also, they do the Medicaid applications, help the client qualify for Medicaid if they qualify, and then they turn it in. They work closely with social services to get everybody on board that's eligible and wants the program. So that's really what Options for Long-Term Care does. There's a lot of different, there's the healthcare worker, there's the HCBS, there's different aspects of it, but that's the general umbrella. Okay. And then we go on to a lot of our health education and promotion and community outreach stuff. So, we have folks that come in and they want to get their blood pressure checked, and, if one of our nurses, one of us is available, we will certainly check their blood pressure. We used to do some more screening. We used to do a cholesterol screening program, which was awesome. It was free, but the funding for that went away. And so, unfortunately, some of our programs, that's what happens when the funding source goes away. We can't continue to provide that service. So, so that was one of the unfortunate things that did go away. Like I said, the flu clinics. We have we have tobacco control program. It's really a tobacco education and prevention program that we have. Probably need to change that word on there. We changed it on here, but we didn't change it on here. So it's all about educating people, and if they are interested in quitting their tobacco, we have tools to help them. So we have the youth recreational helmet program. Basically, it's helmets for kids, and we charge $5 for them, and we can fit them and give them a helmet. So we when we have like child fairs, we would always go to the child safety fairs, but we haven't really had one of those for a bit. We have child passenger safety car seats. We have in-house folks who are trained. We had intentions of getting 2 or 3 more staff in line to get trained, and then COVID hit, so the training has gone away. So we really only have one person who really is certified as a child passenger safety seat person, but we're trying to meet the need of the community for that. Let's see, emergency preparedness and response. Well, front and center with COVID, right? So there's a lot going on in that realm. The Nail It Down program is a program that it is not considered a core function for public health. It is something, it's a community service that we do for our older population, 60 plus, I believe is the age on Nail It Down. People can come in, I think they pay $10 and get their toenails soaked, trimmed. If you are diabetic, we do not do you. You have to go to a podiatrist for that. But if you're not a diabetic, you can make an appointment for that. That program has been put on hold because of COVID. So hopefully we can get it up and running when we get those 70 plus people fully vaccinated. Hopefully we can get this program back running. We do have it's a gun safety lock program. We have gun safety locks in the health department, and we give those out to folks who need them in their home. It is a strategy and a prevention tool to keep households safe, so that kids don't get their hands on them, or people who are struggling mentally, so keep everybody safe. So we have a medication lockbox program that we've been trained in. It's basically for any kind of substance. It can even be prescription pills. Okay, kids are staying with grandparents, and you don't want them getting into those pretty colored bottles or whatever, and so it's a box that they can keep this stuff in, so that the kiddos can't get into it and hurt themselves. So Colorado National Collaborative is our suicide prevention coalition. You probably could speak a little bit more to where Arlena is with that right at this moment.
Yeah, we're currently building a coalition of invested community members. We're looking for youth. We're looking for anybody who wants to be a part of it. And our goal is to look for ways that best impact our community with the suicide issues that we have here, and ways to get information out there. We're currently we'll be looking for a gun, what do they call it, a gun safety advocate?
Gun shop project.
It's called the Gun Shop Project. We're looking for somebody who is versed in weapons, is trained. This can be, somebody who has an investment, and the knowledge. Basically, kind of working with the gun shops in the area to get education out there as far as, instead of having to wanting to turn your weapons over to law enforcement, you get them somewhere safe temporarily. Just kind of re-educating, like the need to, has to do with the red flag thing and how unpopular that is, and
Right, it's really a prevention-driven program. It's not about taking people's guns away.
Not
That
at
is
all.
not at all
The
what it is.
opposite of that.
It's the opposite of it. It's to keep people, because we want people to be able to have those firearms in their home, but we also want the people who might be having maybe some suicidal ideations to not be put at risk. And it's helping, like, gun shop owners get comfortable talking with people, that are coming in to buy a firearm. And it's like, okay, so, you have any idea where you're going to keep this thing? How are you going to keep it? Like just those conversations about, and making, future gun owners be thinking about that, and to keep their families and friends and loved ones safe when they come to visit, or if they live in that home. So it's purely kind of an empowerment and a prevention program, not a enforcement program or anything like that. So we're like really in the infancy stage of getting this going, because we have to actually hire somebody to do it. So, and we're not at that point yet.
So with the suicide prevention collaboration, you were saying you're looking for people to get involved. Will you
Right.
shoot the contact information? If somebody wants to get involved, will you shoot that to Vicky and she'll get it out on social media and on the website
Sure.
and
Yep.
put it on our postings?
The other thing I forgot, the program I did forget, was our Communities That Care, CTC, and that's an evidence-based program that promotes, youth development projects, basically, and to kind of keep youth using their energies in a positive way. And there's different coalitions for that, and, it would be really nice, like, if in the couple months, if you guys wanted to come over and tour the health department, and then we could walk you around, because I don't know if you're like me, but if I could put a face to a name to a program, it makes more sense to me. So if it would just be nice to be able to do that, so that you kind of understand who does what, so, because we could sit here and spew out 30 different names to you, and you're never going to remember who does what, right now, so it's too much. So yeah, so we have 30 staff, right?
Not all full-time. but
Right, not all
most
full-time.
Most of them are full-time.
How many are part-time?
Quite a few now that we've hired our part-time nurses to do COVID, so.
Yeah, we
we've
have a
got-
lot of additional, but they're temporary. It's only temporary, those part-time folks.
So the 30 is just,
It's 30. 30 is a good number.
Typical.
Yeah,
Yeah.
it's a typical number. 30
Yeah,
staff.
I would say at least 5 are probably part-time. That's consistently part-time.
Okay, any questions about all of that? I know. Okay, now we'll give you the test.
They're either so enlightened they don't need to ask anything, or so confused they don't know what to ask.
I know, it's a lot. The other document that I put in there, and it's 12, 13, 14 pages long, this is a pocket guide for boards of health. So our BOCC is our Board of Health, and this, in 2008, they came out with the Public Health Act of 2008, and that's when this got developed, and that's when things changed. I can't remember when Kent was commissioner, but it was prior to 2008.
he said late 90s,
Yeah, yeah.
approximately?
Not that I would remember that, but anyway. So they came out with this kind of just a pocket guide. It's a shortened version of all the stuff that's in statute. And so I thought it would be handy for each of you to have your own. And I'm not going to sit and read this whole thing, but I have some highlighted points that I'd like to go over. So on page 1, it just basically talks about, in general, these are the public health. Public health, in people's, what is public health? Well, public health is science-based strategies to promote health of the community, which consists of, preventing disease, injury, and premature death, respond to environmental threats and emergencies that could impact human health. That is really what public health is about. And then all the things that are listed here are things that are done to support those goals of public health, essentially. Then on page 2, it talks about the Colorado Public Health Act of 2008. And there's a paragraph there, and basically I think the most important statement in that was where it says a strong public health infrastructure is needed and is a shared responsibility among state and local public health agencies and their partners within the health system. And so, in general, the purpose of the act are all those bulletins down below. They basically wanted a structure for public health, which included, the big change was public health had to have its own, they could be obviously part of the county, but it had to have its own financial account separate from the general fund. And that was a big change for public health, because it used to all be in one big pot, and it changed at that point. So the treasurer has a separate public health fund, and that's where all of our monies go into, and that's where all of our monies come out of. Every program we do in the health department, we seek our own funding for. We either have a grant or we have a contract with the state. Every program is funded from a source. We don't make money. We basically have it come in, and we provide the service, and then we get reimbursed for a lot of the stuff we do. So, and with our dental program, for instance, it basically pays for itself in a normal year. I will say that. COVID's created a little bit of a challenge because we've only had half of a year of functioning. So, but what costs we put out, we get reimbursed for. So, so let me make sure. What else do I want to say on this page? Yeah, and that's, where it talks about, on page 3, it talks about the act requires that each county establish and maintain a county public health agency or participate in a district. So an example of a district would be like La Plata County. San Juan Basin is a district. But we are a county public health department. And you have to have, a board of health, you have to have a public health director, and you have to have a medical officer, which is Dr. Aiken. Now, if I happen to be a physician, you wouldn't need that. But I'm not, so therefore you do. And I'm just skimming and highlighting because there's a lot in here. On page 4, it talks about some of the duties of public health agencies. It talks about a community health assessment. And I know within the next year or two, we are due to come out with we have a 5-year plan that we're supposed to do. Again, COVID has completely taken over the state and everything that is being spent money on. So I think I wouldn't be surprised if they put it off for another year of when we are due for that. But we had done just to give you a background, we had done a community survey. And one of the big, we were going to focus on a couple different things, but behavioral health and substance use and abuse were big issues that our community in a survey decided was important, and our data supported that as well. So that's where we were focusing on. That's how we ended up with getting the CNC program, the Collaborative National Colorado National Collaborative. So that's why we were going down that path, and we still are going down that path. We just have a little bit of a slow up, a little bump in the road called COVID. Okay. Sorry. So then it talks about where it says core public health functions on page 4, halfway down. These are the core functions that public health organizations are supposed to provide for communities. So assessment, planning, and communication, that's something we do on a daily basis with all of these different programs that we've talked about. We're doing that. We are assessing our population, we're planning for our population, and we're communicating. The vital records and statistics, we have an MOU with the clerk, so the county clerk does that, okay? And a lot of these other things I already talked about, communicable disease prevention investigation, prevention, population health promotion. We do not have a, what do I want to call it? We don't have a planning. Family planning, that's the word I'm looking for. We don't have a family planning in our health department. We refer to, they have one over at San Juan Basin, we have Planned Parenthood, and a lot of our providers provide family planning. We do, in our programs, and that is part of, Nurse Family Partnership, we talk to families about planning their families. And we provide education, and we provide some prevention tools, but that's as far as we go with family planning. Let's see, what else? Emergency preparedness, environmental health, and so those are pretty much the general core functions which we all provide. Let's see. So I think on page 5, that's where it talks about the funds and the treasurer and the fact that it has to be a separate account, that we, the general fund does not fund public health. Public health funds public health. And therefore, vice versa, public health dollars cannot be used for anything else in the county. So, let's see. Okay, very last paragraph. Halfway down, it says, in order to qualify for state assistance, the county shall contribute a minimum of $1.50 per capita for its local or health districts, and may contribute additional amounts as it may determine to be necessary to meet its local health needs. So the county, Montezuma County commissioners have always opted for the minimum of $1.50 per capita. It's been that way forever and a day. And every so often I come to the commissioners and I say, is there any way possible that we could get more than $1.50? But I'll say that for another time in the future. So, yeah, that's based on per capita. It's based on how many citizens are in, how many people live here.
So the last census, I guess, is what is it, so.
No, we do it every year based on CDPHE's website.
Right, but they
population.
use DOLA.
We don't update it every 10 years. It's based on the state's website every year.
The
And
amount
it's,
is the same.
the amount's the same.
Yeah, the $1.50 is
Yeah.
the same. That's the minimum.
And, okay, so then, and we'll, in future meetings, we can talk more about, a lot of this stuff, but it just gives you an idea of, as far as a Board of Health, and then it talks on page 6, at the top under county agencies, it says in counties with populations less than 100,000, a 3-member board may be appointed, and the commissioners may designate themselves as the county Board of Health. If there was not a separate Board of Health prior to this 2008 Act, and there was not. So that's how it's always been. The meetings should be every 3 months, and we can call special meetings as need be if we have major public health issues. What else? I don't want to belabor too much more on this. Then there's a whole, on page 8, it talks about your public health director and how you select the public health director. And I'm one of the ones that's in the appointments. I get appointed every year by you all in January. And then there are waivers. What else? Powers and duties, administrative oversight. I find this a good book because there's tons of reading you could read on this, but it's kind of the Reader's Digest version of what the Act says. So, one of the things I just want to bring up too, as I have been the director, I've worked in public health for 31 years, but I've been the director here. Well, in 2014, I became the director. So I am learning things every I swear every week anymore. But as I was reading this meant a little more to me than in years past. On page 11, under where it says policymaking, local boards of health, the third section, where it says issue orders. So this is the board and the directors. These are the powers and the duties of what a board of health does. And it says issue orders and adopt rules consistent with the laws, rules, and orders of the state and the state board for public or environmental health issues that pose no immediate health threat. So a lot of the health threats are in statute. Like there's legal rules that we have to follow. I'll just say in environmental health in particular. But then we have these other things that are like, I'll just call it nuisance abatement issues that happen in the public that really, it's part of the Board of Health's role to decide what you want to do about those things. So I think that that's kind of one of the things we could use this Board of Health for, is when we have those issues out in the county, that we discuss those issues and figure out what do we want to do about it. You know, is it really an issue that we should address, or is it something that is not worth, setting a rule or setting a, most things can happen just by having a conversation about something and figuring stuff out. But like I said, as I've been in this role longer and longer and I read this, it's like, okay, so this is something we can use this Board of Health for, to help deal with those, my neighbor has something that I don't like and those kinds of things. Because it happens all the time. Yeah. So we'll talk more about that as time goes on. So, and pretty much just, financial oversight. And Laurel's we can talk budget if you want to talk that now, or we can just go into COVID, whatever. Do you guys have questions about the budget? You want to know what our bottom line is? You don't care?
I care.
There's a lot to know. I know there's a lot, and your brains are probably like, you've got so much going on in your head right now. So, yeah, anyway. We can talk budget at a later time. Do you have any specific questions about our budget? About what things cost, about our bottom line dollar? Anything?
I don't.
Okay.
I can just say real quick that
Yeah.
76% of our 2021 budget is CDPHE. The 17% is fee for service, which is our dental. That even includes like septic, food, our portion of the food, and of course all of that goes back to pay for the people that are doing that work. WIC, which is kind of a federal budget, that's 4% of our budget. And then we have foundational and donations, which are about 3% of our budget for 2021. And my door's always open, my phone line, you guys can call me anytime, come by. I can bore you all day long with all this stuff. We do 25 different budgets under that amount, and every month I have to submit that to get reimbursed for it, or we get tracked. I get audited probably about 9 to 10 times a year. We have a low risk rating with the state because our audits are so good. We are to the penny, pretty much. We are to the penny with the treasurer's office and administration on all of our expenses. Anytime you guys want to know more about that, just let me know.
I do have one question.
Sure.
I see where restaurants were forgiven their licensing fee this year.
Yeah,
Does that affect your bottom line?
They gave us, I haven't seen the money yet, but I've seen a purchase order that they're going to reimburse us the difference, because yes, it does. That's how we pay for Cody.
Right.
Right.
Yeah.
Right.
Now, some of them are still coming in, but that's because they were like your convenience stores that sell food still have to pay.
Right.
Certain people still have to pay, but not restaurants.
Not restaurants.
So I'll have to do the math when I get the actual figures that they have.
Yeah, when that came out, it sounded wonderful for the businesses, but we're like, oh, okay. So how is this going to work for to cover our costs, but yeah, that came
But
out shortly after
They're-
that.
they're
so,
paying for it.
Yeah, if they
will.
cover it and they
Yeah,
pay for it,
yeah.
then it's just another way that the state is working to
Yes,
help the businesses
Yes.
that are impacted because of
Yes.
not by their choice.
right.
Well,
Right.
There's
you
a
see,
mandate that came out by the state.
you see this coming down the line, that certain businesses were forgiven sales tax to, they didn't have to send in their sales tax for, I think it was November, December, and January. Now restaurants don't have to send in their fees for inspections, and the state's running a $4 billion deficit. You wonder when this is all gonna catch up to it.
I don't know how the state is paying for that. I don't know if they're using,
I
do they
don't
have
know either.
access to these?
Do you
CARES
remember the
dollars?
section in your college algebra class called imaginary numbers?
They,
It's a real thing. Well, it's an imaginary thing. Look it up. But they say they behave just like real numbers.
Yeah, I just don't know. I mean, I don't know if it's kind of like how we're paying for our temporary part-time nurses. That's coming out of the CARES dollars. Well, the CARES dollars are coming from where? It's,
The CARES dollars come from a federal government
Yeah.
that's $28 trillion in debt.
It's all taxpayer money.
It
It's all,
is,
it's
it
all
is.
a base
We're-
of,
it is.
somebody has
Yeah.
paid it at
Sure.
some point in time.
right,
Just because you don't pay it today,
Right.
doesn't mean you didn't pay it yesterday and you're not gonna pay it forward,
Right.
'cause I'm,
That means my great-grandkids are now indentured, and I don't even know them yet,
yeah. Yeah, it's gonna be
Correct.
tough
that,
in the
when you
future.
start talking trillions, that's
Mhm.
beyond what most of us can even imagine.
Yeah.
But,
we digress.
Well,
Yeah.
Well, one
we'll
thing,
get
you
off
know-
of, we'll leave Laurel alone with the budget.
Not my doing.
Laurel, you
But it-
better just,
I know. I'm telling you, I kind of get a little loud in some of those meetings with the debate.
well, I think one thing that Laurel and I talked about earlier, and we all, like what Laurel said, her door's always open. We love the communication. So if you have questions, if you have concerns, please come see us, or please pick up the phone and call us. Jim calls me, if 2 weeks go by, I think something's wrong, because I haven't heard from him.
yeah, I actually, I
So-
call them both. quite
Yeah,
a bit.
yeah, so
Or
it's
if I
great.
have time, I stop by.
The communication is awesome, and we really appreciate that about you, and so we hope that this is how we can move forward with you guys too. We really are pretty open about everything, sometimes maybe too much, but I'd
No.
rather be open and upfront than not, so, okay. So that being said, we could talk a little bit about COVID. I'm not running over, right? Okay, we still have time.
No, you're good.
Okay,
I'll
so
stop you.
you'll set your timer on me, right?
I have the
Oh,
timer
okay.
set. I'm watching it.
At 5 o'clock, I'm leaving.
Oh, gosh, we won't be here at 5 o'clock. So I put together a few kind of facts that we're doing as far as COVID goes. We'll start with testing. There's still continues to be a lot of testing going on. The one really good thing about this COVID whole pandemic thing, I think the partnerships in our county have grown immensely. I mean, we work so well with the hospital, has been amazing. Matt Lindsay and his crew have been amazing with the testing line. It's been incredible. We have had nothing but good things and growth and increasing relationships. So if you got to find the silver bullet, that's definitely one of them for me. Is just the partnerships have been great. So with all different institutions. So the testing for COVID continues to go on in the community. It's going on at the hospital, the drive-through, and they've done a great job. There's a lot of different labs that are used for different reasons. Sometimes it's pay source, sometimes it's because they're an employee somewhere that needs to have a quick test. There's different options, okay? And different situations are decided depending on what's going on. Public Health does a testing on Wednesday, again, partnering with the hospital. We do it over there at the hospital drive-through. So that's on Wednesdays, and our Wednesday testing that we do, there's no requirements needed. You don't have to have symptoms, you don't have to have an order, you don't have to have money, nothing. No insurance needed. You just pull up, show us your ID, give us a phone number that we can call you on that works, and that's it. That's all we need. So that's the testing that we do on Wednesdays. There's a lot of additional testing going on in the fact that RE1 school district has been educated, and they are doing testing for their employees if they want it. Twice a week, they will swab employees at the drive-thru at their admin building, so that's another testing option that's going on. And they're using the Binax now to do that. Cedar Diagnostics, you can make an appointment at Cedar Diagnostics, get a COVID test. That's been going on and still going on. Skilled nursing facilities and nursing homes are doing their own testing internally, and with their residents as well as their employees. So there's a lot of testing going on. A lot of numbers are being sent to the state. So, because I know there's a lot of discussion about our numbers that we post on public health websites. And yes, the testing is not the total number. Yes, the positivity rate is not accurate. It's not going to be, because we don't know the total number of tests being done. There is no way that we have capacity to find that out, nor am I going to spend my time doing that. So everybody funnels all that information to the state, and those state numbers that they are putting on there for the negative tests, that's the most accurate number. Might not be accurate, but it's closest to accurate. So I've had this conversation with the county PIO, because I know she's been getting a lot of questions about it. So, but that's why we have the statement on there that just does not include every test being done in Montezuma County, because there's no way that we know that answer. That number that's posted is a combination of what the hospital does and what we're doing, because I can't count all those tests.
Well, not with that attitude.
I know. But it wouldn't be accurate if I even tried.
You need to give it to Laurel.
There you go. She's got nothing else to do, right?
I'm doing the scheduling for vaccine for 1,800 people.
Not a problem.
Sounds like it's an accounting
It
problem
does
to
sound
me,
like
yeah.
So anyway, so I just wanted you guys to know that if you hear people, ask questions about that, that is why. It's not an accurate total number. And unless you have the full number, you can't really get a really good positivity rate. So anyway,
Does anybody have the full number?
the state's got the closest to it. Yeah. Because I think actually, as of yesterday when Vicki called me, the state's publishing, it's twice the number that we have. Because we're at 11,000 something.
For tests.
For tests.
Yeah.
Yeah. I think the state was at 22,000 something. So that's why Vicki was like, why is this? So I had a conversation with her to explain it so that she at least understood it, and she did put something out there on Facebook. And I understand that people are looking at this and that it's important information to them. But at the same time, here I go with my prioritizing again, right? I mean, our priorities have got to be, I don't have a data person on staff, so we're putting our energies where we really need to be. So anyway, let's see. So our confirmed positive cases, I have to say, even statewide, yes, I'm hesitant to even say it, but they're trending in the right direction, which is good. Now that means confirmed positive cases. That means the people who are choosing to get tested. There are still people out in the community who are choosing not to get tested, right? But this is where the education comes in. If you choose not to get tested, that's fine. But isolate yourself. Treat yourself as though you have it. Do all the prevention tools that we're asking people to do so that we can still decrease the spread of disease. That's the message. So, but we are seeing a definite trend downward throughout the state, which is great. I do believe we are past that potential holiday surge. We did see a blip, an increase, but it didn't, at least locally and even statewide, it didn't seem as big of a blip as we did a month ago. So it's looking good. So I appreciate the fact that people are doing what they can, because it's working. Vaccine distribution. So the way vaccine is divided at the state level is hospital and retail pharmacies are getting 60% of the vaccine. Community partners and LPHAs are getting 15%. Federal qualified health centers.
And
are
for
getting-
those listening on YouTube, an LPHA is a
Oh,
local public health
sorry.
administration or agency.
Yeah, agencies. And F2HC is federally qualified health center, 15%. And then there's a 10% bunch that goes to CDPHE/Governor's Equity Task Force. So that's how vaccine is distributed across the state. Now, yesterday I was on a media call, actually, and General Scott Sherman was on there. And there was a lot of questions about where, there's the dotted line. Okay, I gave you all a copy of this phase thing, okay? So, so where the dotted line is in phase 1B, which is where the people age 70 and older, it's underneath that. So they were asking the general and Scott Bookman about where, are we going to have priorities? Who gets it when we go below the dotted line? There will be priorities set. They're working on that, but it was almost 100% certain that the first people that are going to get vaccines offered to them are educators, pre-K through 12, and child care providers. They're going to be the first bunch that have vaccine offered when we have the approval to go below the dotted line. Right now, we are still working above the dotted line. We are still vaccinating our 70 plus. The hospital's doing the same thing. City Market and Safeway, I think, but they're vaccinating very small numbers. Last I heard it was 10 people a day. So I don't want to speak for them because I'm not exactly sure what they're doing. But the hospital's vaccinating as much vaccine as they can get. We're giving, and we're operating in the same mode.
So are we still allocated basically our 100 per week to just our local public health department?
So,
Is that still where we're sitting?
well, let me talk about the vaccine. Mallory is our vaccine ordering person. She's one of our immunization nurses, and she's taken the lead with this, and she's doing an awesome job. And so the way the vaccine ordering process works, I had her kind of give me points. So basically, every week we place an order for vaccine. And we have to place our order by Monday at midnight for the following week, okay? So, and that is done through CIIS, which is the Colorado Immunization Information System. That's what it stands for. So that's how we are placing our orders. Before we could do that ourselves, we had to do a survey and put in what we thought we could give in the course of 10 days. But at least now we have an ability to put it in ourselves. We put our own request in. And again, we think about what can we give in the course of 10 days. So that's what we submit by Monday at midnight, okay? So then what happens after that, on Thursday afternoon, the ordering opens up for the state. That's when the state, because we submit our orders to the state. Then they open up at the state level. That's when they look at our orders and they decide if they're going to accept what we asked for, if they're going to amend what we asked for, or they're going to say, no, you're not getting it. And they do that dependent on what we ask for as well as what the state is allocated. So the state is working with, they've given this much, and they're told on Thursday how much they're given, and they look at what we've put in on Monday to decide what they're going to give us. So, and all based upon that little formula I told you. So LPHAs get 15%. Community partners and LPHAs get 15%. So that's kind of, how they're making these decisions.
So are we
And-
truly getting our 15%?
I haven't done the math. I have
I'm
not done the
looking at
math.
Laurel.
I haven't been part of, I'm just
She's the
scheduling.
math- She's the math.
Yeah,
guru.
and it's based on how many
Yeah, I would
the
say yes.
state is getting. I think we are.
Yeah.
And the allocation is supposed to go up. I mean, they're really saying that across the board, the allocation will go up, and that's why the March 1st is what we're looking at for below the dotted line.
So we're supposed to get that percentage of the total amount allocated to the
To the
state?
state, yes.
Or are they saying all local public health
Well,
get 20%?
yes.
But then we're taking that total 20% and allocating it by population?
Right. They're
Okay.
looking at the population, if we're doing 70 pluses, they're looking at how many 70-plus-year-olds are in our community. They're looking at how many healthcare workers you have in your community. So, and they're looking at DOLA and DORA and all those sites for those numbers, which are 3 years behind, right? So, I mean, it's not current, but it's the best they have to go off.
So we
Right,
talk
because
about
they
a
didn't
dotted
just do
line,
a census.
And we can sit here and look at a dotted line because we can see it, but where can the people find, when we're talking about below the dotted line, it's, you know, frontline essential workers in
Yep.
education, food and agriculture.
Yep.
Where can they view this so that, you
This
know?
is on the governor, it's right off the governor's website. I pulled this
Okay.
right off the governor's website.
So do we have something that we can, it's just on CDP or the governor's website?
No, the governor has it. I didn't even look on CDPHEs for this. This is the governor. The governor's who's setting this. CDPHE is not determining this. The
So-
governor's doing this.
Okay,
So,
all right.
I mean, he's talking to CDPHE, and he's talking to Rachel Herlihy, the lead
Right.
epidemiologist
Yep.
of the state. I mean, he's asking for everybody's input, but this is posted on the governor's website.
Well, just so that everybody realizes what's below that dotted line, let's see, I start out with food and agriculture, manufacturing, U.S. Postal Service, public transit, and specialized transportation staff, grocery, public health, frontline essential human service workers,
Yep.
and direct care providers for Coloradans experiencing homelessness.
Yep. There's a lot of people.
So that is kind of what, as we're sitting here talking about what's below the dotted line, that's in phase 1B.
Yep.
So it's, you know, the people age 70 and older are above that dotted
Right.
line so that people out there understand that.
Right.
The average person, we're sitting here looking at a piece of paper, can understand that. A lot of people out there are like, well, what does that mean?
So
And-
below the dotted line is almost phase 1C.
Well,
Well,
they
they
talked
didn't-
about trying
they
to label
talked
it
about
that.
that.
Yeah.
But, yeah.
But they didn't
But
do it.
they- Yeah.
So they just said it's a dotted line. They just drew a line.
And I, the reason the governor is, I mean, obviously we can figure out that the high-risk healthcare workers, I mean, they're frontline workers, they're taking care of the COVID-positive people. I mean, they clearly are at great risk, right? So they've already, pretty much in our community, have been done.
Have been-
We are in the 1B section now. And the 70-plus, the goal, whatever the WIG is, I forget what the governor calls the WIG, something goal. Wildly important goal. That's what he calls them. The reason that he's going for the 70 is that the 70-plus-year-olds are 78% of the deaths and the hospitalizations are 70-plus-year-olds in the hospital. So that's why he's aiming for the 70-plus. And he didn't change it. When the CDC came out with their 65 and older, the governor did not change. He stuck with the 70-plus because it really is, in our state, that is what we see.
70 plus.
Yes. Mm-hmm.
4 out
So-
of 5, I think they said.
Yeah, it's significant. So,
What's our county demographic for age, do you know?
We have an older population. I can pull it up on
I
the
don't
Region
have
9
that.
website.
Region 9 would have that. She just posted that not too long ago, but,
yeah.
um,
But we definitely, I mean, we have an older population here, and so, and we have, I mean, we have quite a few people on our waiting list, but we're doing good. We are really shortening that waiting list up, and we're doing well.
This is the first week that it has gotten shorter
Right.
and not longer, and we're
Right.
able to we'll be doing 300 people on Friday.
Yep.
We did
First time shot.
150 today.
Mhm. Right, because we're starting our second doses now on people. So this morning, and I can give you numbers too, because I've got totals here, but,
that's
but this morning we did,
50.
second doses, 50 people this morning. So they're completely vaccinated now. And then this afternoon, we did another 100 first-time doses. So, and then on Friday, we're doing 300 first-time doses.
Good.
So, and all of these clinics, this is the tricky part, right? You do first-time doses, you got to schedule your second dose too. So this is why, and it's been great. Jonathan, has allowed us to use the space in the senior center awesome. We've gotten great feedback from people who have come through our clinic. Today, we were at the fire station, which has been awesome, too. And I think we're there again next Tuesday, but then we're moving them back to the annex.
So what
So-
kind of numbers is the hospital doing?
I don't have their numbers. I'm
Okay.
sorry, Ken. I don't.
It seems to be averaging around 300 a week.
That,
I
yeah,
mean,
I was
they-
gonna say it's probably more because they're getting that 65%.
Well, their allocation has been challenging, because it's all dependent on how much vaccine they get.
Right. Well, what
So-
I'm getting at is, how many more total vaccines do we need in Montezuma County?
Yeah, to
Because
get the
that
70%.
want the vaccine. you know?
Right, right. And that's true too. I mean, it's not, this is not a requirement. This is,
Right.
People have to want it, right? So, I don't, and people have asked, I've been on numerous phone calls where how do we know when we hit the 70% of the 70 plus? Because the goal is to have that done by the end of February. That's the governor's goal. I see us easily doing that. We need to, once we got a good handle on the 70-year-olds, we're going to do the rest of these folks that maybe have been missed, the firefighters, police, any correctional workers, funeral services. We've gotten some of those folks already, but there are some people that fall into this healthcare worker with less direct contact with patients, home health employees, things like that. Make sure we got all of those people done. My goal, my personal goal, is to have all that done before the end of February. That's what we're shooting for. So that when we hit that dotted line and March 1st hits, we get the blessing from the governor to move forward. So, right,
And our February clinics are all second dose.
right.
So we've got it spaced out that we're right there on a Tuesday.
Are most of ours Pfizer or Moderna?
No,
Because they
Moderna.
go Moderna. So
We're
we're
doing
going to
Moderna.
28-day
Yeah,
um,
yeah.
space in
4
between.
weeks. Mm-hmm.
Commissioner Lindsay, the breakdown is given as persons over 65, but that's 22.9%. So over 70 is probably roughly 70 or 20%.
Mm-hmm. Yeah. Yeah. So I don't know what the hospital's latest vaccine count is. I don't know that. But I know when they're getting the vaccine, they're getting it out the door as quick as they can. So, so I was talking about the ordering process. So, and then we also, just when we walked over here, we just got an order. But we also get the ancillary kits that go with it, which the ancillary kit has the syringe and all that stuff that goes with it to administer the vaccine. The second dose orders, here's the other little new thing, is that the second dose orders are being handled at the state immunization branch. They place second dose orders on Sunday evening. They are shipped on Monday and arrive to us on Tuesday, and all vaccine always arrives to us on Tuesday. So that is the ordering process. Now, so we look at how many vaccine we've given, and that's what we put in the request for, because you have to plan what can you give in 10 days. So we'll look at what we've given this week, and next Monday, when we order the week for the following week, that's what we'll ask for. So that's how the process works. Whether or not we get that full amount, that's where it makes it hard to plan, because you don't exactly know how much you're going to get. And that's everybody, everywhere has that same issue. It's, until there's more vaccine produced and the allocations become larger, it's a slow process right now. So, but we, here in this county, we're doing well. We're doing well. So, anyway, as far as doses go, just for public health, okay, as far as public health has given, including today's clinic that ended already, we have given 607 first doses. We've given 61 second doses. So that's where we are in public health, okay? And then on Friday, we'll do 300 more first doses. So,
So we'll have 900, almost 1,000 by the end of the day Friday.
just from public health.
Just from public health, right, that doesn't
Right,
include
the hospital's
the
given.
pharmacies, hospital, or
right,
anybody
right,
else, that's just our
Right.
portion.
Right,
Good.
so, okay. Do you have any questions about COVID or any of that stuff with vaccine or testing or anything? Any?
Will they be able to keep up with the second doses, the demand for the second doses
Yes,
on a timely?
yes. Mm-hmm. Yeah.
Yeah, that's what we're doing all February.
Mhm.
We've got quite the system set up, it's kind of nice. We were waiting for the state system, but that was, not feasible for
Yeah,
our area.
no, we-
So we created our own. So we've got waiting lists according to the different tabs, and we are working on keeping it fair, first come, first served basis. Working down, we've got volunteers coming in and helping us call and getting people on.
Yep.
So basically, let's say like today, there were 100 people that got their first dose.
Mm-hmm.
In 28 days, same time, same place, see you then,
Yep.
type of thing. So it's not confusing, we're
Right.
keeping everything consistent.
Right.
Everybody in February is the same time, same place,
Mhm.
type of thing, and
Yeah.
it's been kind of nice. We're getting through it, and again, like I said, I like seeing that list get shorter instead of
Right.
longer. So
Yeah.
it's kind of
And,
hopeful.
and
And
people.
just as an update, Shaq just sent this off the hospital's website so that everybody else out there also knows. SHS has 1,358 first doses and 565 second doses as of Monday.
Cool.
So
That's
along with just
Which
what
was
we
yesterday.
have
Mm-hmm. Mm-hmm.
is
Yeah.
pretty good.
Yeah. No, I think we're doing well. The hospital, you know, they're doing it as fast as they're getting the vaccine, they're getting it out. So, you know, and we're sticking with Moderna. I mean, if we got Pfizer, we would use Pfizer, but we'd prefer not to because it's really hard to track when you're doing both, because you can't mix them. You can't get a Pfizer and then a Moderna.
Yeah.
So, you know, we're sticking with the Moderna for us. And there's the whole, because it's cold, it's really super cold, ultra cold frozen, and there's a process, and, you know, then we'd have to, and Mark's great, he would help us, you know, get our vaccine out of there, it's not a problem, but it's just an additional step that we really, you know, we're good with the Moderna, so, anyway, yeah.
Okay.
Okay? All right,
Very
well,
good.
thank you.
I know Dr. Aiken was sick from his second shot. Are we having much reports of anything like that happening?
Yeah, so your body, after the second shot with both the Pfizer and the Moderna, we are seeing, it's not that you're sick, you don't have COVID, you're
Right.
not infectious, none of that. It is simply your body's immune response, and it's a good thing. I know it doesn't feel good at the time that you're having it, but it's a good thing that your body's doing that. So, yes, to be honest, we are seeing, we're hearing a lot, we're encouraging businesses to stagger your employees. Don't have them all done in the same day unless you want them out in 4 weeks and 1 day. You know, so I mean, it's kind of common sense, you know, you don't want to do everybody at once, you know.
Yeah.
And not everybody's having any problems, you know, but we are hearing and seeing folks, and it varies anywhere from just feeling like just listless to fever to nauseous to, you know, there's a lot of, you know, wobbly, you know, feeling, you know, unsteady on your feet. So we are telling people, like when they were there today for their, you know, because we're talking about the 70-plus population, right? Make sure you have either somebody to check on you the next day, or, you know, kind of have a little bit of a game plan, have some food in the house, have some, you know, just so that you're prepared in case you may not feel too good the next day, you know.
Right.
So we are telling people that. So, and it's a normal thing. It's okay, and it will pass. So. So, yeah. Any other questions?
I have none. Again, I would just encourage you guys, if you have the opportunity to, you know, stop by and look at the van, look at, you know, kind of what they do, look at the new dental
Yeah, no, we're,
space.
our
I
doors
can
are.
still give a shot.
And, other than that, you know, I think we're way ahead of the game in comparison to a lot of the other counties that I talked to around the
Yeah,
state.
yeah,
And,
I would say that too.
I think we're actually
Mhm.
doing pretty good over here in
Yeah.
the southwest corner of the state.
And sometimes that can be detrimental. You won't get near the attention you do if you're deep in the hole.
Yeah,
Yeah.
so,
Well, I think, again, the partnerships have been great. Our employees in the health department, I mean, you know, I mean, just Laura alone coming up with this schedule and these spreadsheets and, you know, I mean, we really realized that early on, that what the state had in store for us wasn't gonna work. I mean, it just wasn't gonna work. I mean, that whole system of, you know, how to sign up for, you know, they were having, people can go in and sign up for their own vaccinations and, oh my God, it was a nightmare to think about that because we have to schedule these, you know, apart, you know.
Are you
days apart.
questioning the omniscience of the state?
No.
I will.
But anyway, we really learned early on that we need to kind of figure out our own way through some of this, and we've done it. And we're, you know, I mean, we, you know, worked with IT. They have a little button thing on the website. People can click it, give their information there. I mean, you know, it's simple to get yourself on our list, you know. And I know people are putting themselves on all the lists. They're on City Market, Safeway, the hospital, and ours. Great. We don't care. Just get it. Just get the vaccine. And once you get it, let us know so we
Yeah,
can take
take
you
your
off of
name
our
off
list.
the
Right,
list.
right. And we have people calling us, and it's wonderful. You know, we want them to do that. We don't care who gives it to them. We just want them to get it, you know, if they want it. So we're good with that, you know. But if they circle back around and say, hey, remove me, that's awesome. We've gotten several phone calls like that. So, and we're just grateful that they're getting it. So, anyway.
Yeah, and I would just add that it's not just the vaccine. I think through this
Mhm.
whole process, you know, we've always taken into consideration what the state wants us to do, but we
Yep.
also take into consideration what works for our community.
Right.
What is feasible for our staff.
Mhm.
We've got nurses, you know, we've had people working weekends for 10 months. You know, I've spent probably the last 3 weeks, 10-hour days, no
Mhm.
lunches, trying to figure this out.
Mhm.
That's what we do for our community.
Right.
We don't always do everything the state wants us to do because it doesn't work.
Right.
It may not work here. And so, you know, our doors are always open when something like that comes up and you want to
Mhm.
know, what are you guys doing?
And we really try. I mean, we listen to what's recommended, we try. But sometimes you have to land where it works. I mean, it's not, we're never putting anybody at
No.
risk or anything like that, but it's just a matter of sometimes you gotta prioritize and figure out what you absolutely have to do and what maybe we can, okay, sort of shave this off a little bit and we're gonna do it this way instead of that full-blown way, you know, so, but it's just what we have to do.
Has anybody looked, I mean, this is down the road a long
Sure.
ways, but have they looked at care for people that did contract the disease, the long-term effects that are there?
Yes.
Are they even looking at any type of care or therapeutics for these people?
I don't have an answer for that.
Okay.
Because there are definitely residual effects of this. And sometimes there are things you live with forever, and sometimes I think some of the residuals are why we've had some of the deaths.
Yeah.
So, you know, there's clearly side effects that inhibit people's ability to function. So, I don't know. And this is why I personally, I'm just gonna get on my little recovered kick, because I personally think that recovered is very misleading. I don't like recovered numbers, because I think we're making a judgment call. I don't think they're recovered. I don't. Because we don't know what recovered looks like, you
Right.
know? It's really, they're released from isolation, we know that, right? I mean,
Yeah.
they're out of that phase. But that recovered thing,
Well, they're not contagious.
yeah, right, exactly. They're not contagious, they're released from, but I feel like we're saying they're A-OK, good to go. We don't know that.
Not
We
everyone.
don't know that.
You know, you've read about, there's effects on body and body functions,
Right.
you know, visual effects.
Yeah.
Lungs.
One of those-
Circulation,
lungs,
cardiac, yeah.
And a term that was created for a movie, brain fog.
Mm-hmm, right, right.
course, I think I walk around with that a lot of times.
They call that age also.
But it is definitely, if people, I'm sure, I know people are studying this, but it's a very interesting disease process, clearly, and long-term effects, we're not gonna know that for years, but, it's a concern for sure, so,
20
Yeah.
years we'll be able to answer that question.
yeah. We're all gonna be in the history
Oh,
books,
wait.
right?
Medicine is advancing with that and artificial intelligence.
Yeah, yeah.
You know, when you have telesurgery,
Oh, boy.
that's not far off.
I know. I know. Well, okay.
I don't have
Thank
anything
you.
else.
Great.
Unless you guys have
So our
anything
next
for us.
one is April 6th, our next meeting. So typically, we ask if you have any specifics that you would like to hear about, discuss. You don't have to answer that right now. You can think about it. If you have a certain organization you want us to bring to the table. I'm thinking if we look at that booklet that I shared with you, maybe some of these these health issues that are going on in the county that are not under statute, that are these miscellaneous things that are going on. What do we do? Should we talk about them? Do we bring it to the table? Do we, those types of things. I don't know, but, I want you maybe think about it and see, you guys can talk amongst yourselves and figure out what you would like us to take direction-wise on April 6th, so, okay,
Okay.
great.
What do you
Okay.
think, Bobby, if at our last department head meeting in 2019 or our first in 2020, I had all the department heads do QPR training. What do you think about QPR training for the new commissioners and getting it out over YouTube at the same time?
Sure.
Just an idea. They may trump me on that and come up with something else.
Sure, yeah. Yeah, I think whenever there's change, sometimes it's a good time to evaluate what we're doing, right? And see how we want to utilize these meetings, and, I'm open to whatever direction we want to take. If it is just still having guest speakers come in and talk about certain things, that's fine. I think we, kind of looking at some of that stuff that's in that book and using our Board of Health to help make decisions about stuff that goes on in our community, I think would be a good direction to take, So,
Outside of COVID-19,
yeah.
what do the two of you see as the biggest health needs of the community?
Pre-COVID, well, actually even post-COVID, during COVID, behavioral health is huge. People's mental health is, I think all of us, in one way or another, have been touched in a behavioral health way with COVID. It absolutely makes you think about everything you're doing and the mental health impact of that. You don't just, have
Yeah.
two families over for dinner. You think about it. You want to, is the risk worth the, there's just all these things that we deal with. I think it has impacted every single person in the world, actually.
Maybe
But-
we can all apply for PTSD funding.
Funded by whom?
Yeah.
Well, let's print some money. Computers are creating digits now.
Well, why don't we print some Chinese money and pay off the debt?
Well,
Okay, I'm
We're gonna have to get a
I
grant.
do think that behavioral health is a problem, though. I do think behavioral health, and that's what our community's voice was when we were on the track of addressing our public health survey and where we were going with that, our improvement plan. We were going down the behavioral health lane. And I think we're still there. I think that's still a huge issue and need, and it doesn't, it can be a substance abuse issue, it can be a suicidal ideation issue. There's so many, the gun shop project falls into that. We have places where we can work on these, but it all is lumped under a behavioral health umbrella, if you will. So, Yeah, I would say that's a,
I would agree with that. However, I think what comes to mind for me is substance abuse. I think that's, always has been and probably always, maybe not always will be at the top of the list. For me, that's kind of what I see, and I think if we had something in this area that could help with that, we could actually make an impact in seeing things, but it does fall under behavioral health overall.
right, right.
It is a behavior.
We're gonna be dealing with the mental health aspects of this for years, especially in
Oh,
our children and
absolutely.
stuff that don't
Yeah.
understand
Yep,
Yeah,
what's going on.
Yep.
This is something that's gonna go on forever.
right,
yeah,
Right.
it's just hard. It's been hard. I was joking the other day, but I don't think I really was joking when someone asked me, well, how are you doing? You know, because I hear it, I see it, I work it, I understand it. And I thought there for a minute and I said, you know what, I'm kind of numb with no feelings left.
Yeah, it's
I'm
definitely.
halfway joking, but, honestly, and then I can't even imagine when you have not a good home life or, some other issue, you lose your job. It's going to last a long time.
It really is.
And that is public health as well,
Yeah.
Okay.
Okay?
All right, well, thank you, and,
Thanks for coming.
yeah,
Thank you
and,
guys. Nice to
let
meet
us
you.
know what you want to do with our next Board of Health meeting, okay?
All right. We'll give
Okay.
you a couple minutes to pick up your stuff, and then
Yeah.
we'll reconvene as the BOCC and not the BOH.
So we're going to go to a 5-minute break.
5-minute break. We'll give Bobby 5 minutes. Laurel, you count it. on YouTube.
Okay, we're on YouTube.
Okay, we have finished our Board of Health meeting. We're going to reconvene as the Board of County Commissioners. And with that, we actually have an executive session that we have to go into. With that, Mr. Stevenson, I will let you read the CRS.
I move we go into an executive session for the purpose of determining positions relative to matters that may be subject to negotiations, developing strategy or negotiations, and/or instructing negotiations under CRS Section 24-6-402. People present during this will be the 3 commissioners, the county attorney, the county administrator, and our county clerk.
Okay, it has been moved and seconded that we go into executive session for the purpose of determining positions relative to matters that may be subject to negotiations, developing strategies for negotiations, and/or instructing negotiations under CRS Section 24-6-402, parentheses 4, parentheses E, and present will be Kim Purcell, clerk, Commissioner Stevenson, Commissioner Candelaria, Commissioner Lindsay, Attorney Baxter, and Administrator Powers.
I think you have to vote now. You have to call the vote.
All those in favor?
Aye.
Aye.
to,
He'll typically exit for you, whatever we're gonna use.
Okay, we're live on YouTube.
So we just need to move to come out of executive session. You don't have to read any of the statutes.
No, I'm sorry. I confused you, I'm sorry.
That's all.
You just moved to
I
come
so
out of.
move that
I'll second.
Okay, it's been moved and seconded to come out of executive session, and we will come back in as the BOCC. And I think we have reached the end of our agenda.
We have, and basically, we're gonna follow up. We're not gonna necessarily announce anything right now of executive session, but we're gonna continue to negotiate with some parties.
I like negotiating parties.
Yep.
Those are the best.
Yep.
Okay, gentlemen, with that, I would entertain,
A motion to adjourn.
Motion, we adjourn.
second it.
all right, it's been moved and seconded that we adjourn for the day. All those in favor?
Aye.
Aye.
Aye.